Nausea, vomiting, and diarrhea are all symptoms, not a disease in themselves. It is important to understand that treating these symptoms will not fix the underlying condition. In order to treat our patient, we need to understand why these symptoms are occurring and work to correct the underlying problem. However, symptomatic treatments can increase comfort in our patients and help them feel better, improving healing. Antiemetic is a term that covers a wide variety of medications that are used to decrease vomiting and ease nausea. Antidiarrheal is a term that covers a variety of medications that are used to decrease peristalsis and relieve diarrheal symptoms. First-line prescription treatment for nausea is 5-hydroxytryptamine 3 receptor antagonists. These block serotonin produced in the brain and stomach. These are available by prescription only, with the most common example being Zofran. Antihistamines block signals to the movement center within the brain and work well to treat nausea associated with motion sickness. Many of these are available over the counter, such as Dramamine, others by prescription only, such as Phenergan. Other anticholinergic medications may also be used to suppress the vomiting reflex, with popular example being scopolamine, transdermal patch, that is often prescribed before a cruise for patients to avoid seasickness. Phenothiazines work by blocking dopamine receptors that stimulate vomiting. These are commonly used to treat chemotherapy-associated nausea and vomiting. Cannabinoids are manufactured from cannabis. They are taken before and after chemotherapy to reduce related nausea and vomiting. Although some states allow for use of this drug, not all do. It is a Schedule I drug with a high likelihood of addiction. Due to the scheduling, there is limited research on the potential side effects or long-term effects of using these drugs. Phosphorated carbohydrate solution, such as Amitrol, would decrease hyperactivity of gastric mucosa, which can reduce nausea, vomiting, and diarrhea, although it does not tend to be as strong as other medications. This is contraindicated in patients with diabetes mellitus due to it containing high levels of dextrose and fructose. Absorbents are medications used to slow diarrhea. They should be taken after every loose bowel movement and work by absorbing toxins or bacteria. The most common example is Pepto-Bismol. It is important to notify patients using absorbents to rinse their mouth with water after taking the drug, as these medications are known to temporarily turn the tongue black. Opioids and opioid-like agents may be used for the most serious cases of diarrhea. These work by decreasing peristalsis. Imodium is an opioid-like antidiarrheal medication that is available over the counter. Imodium binds to opioid receptors, slowing muscle movement and decreasing peristalsis. As an opioid-like agent, it does not create the high that opioid medications are known for. Medications are also available to treat flatulence not associated with diarrhea. Generally, this can be corrected with changes to the diet, but there are also over-the-counter medications such as Gas-X that can relieve pressure, bloating, and gas related to flatulence.